Hello everyone, welcome to the latest webinar from our Queen Elizabeth Scholarship Program in Strengthening Health Systems, brought to you by the McMaster Health Forum at McMaster University in Hamilton, Ontario, Canada. For today's webinar, I will provide you with a little bit of information on the McMaster Health Forum, the Queen Elizabeth Scholarship Program, and the current version of the scholarship that's offered here at the forum. I will then turn things over to our incoming scholar presenter, who's Keat. He comes to us from Singapore. He's going to provide a reflection on the work that he's done here at McMaster and how it will impact his future work. Here at the McMaster Health Forum, we aim to be the leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders. We act as an agent of change by empowering stakeholders. The current Queen Elizabeth Scholarship Program is run by a partnership between the Rideau Hall Foundation, Community Foundations of Canada, Universities Canada, and individual Canadian universities. The purpose of the scholarship program is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The current version of the Queen Elizabeth Scholarship Program that's offered here at the McMaster Health Forum is called Strengthening Health Systems. Our scholars will contribute to strengthening health systems and become part of our large and growing network of health system leaders. The forum's current QES program has had 3 cohorts of students. The first cohort, that you can see on the screen here, comprised students who mainly went away or visited us in the calendar year of 2016. Our second cohort of scholars, which comprised 22 students, primarily engaged in their scholarship in the calendar year of 2017. The third and final cohort of the current version of the Queen Elizabeth Scholarship Program here at the McMaster Health Forum primarily went away or visited us in the calendar year of 2018. Today's presenter comes from the large group of incoming scholars who worked with us in the spring and summer of 2018. Today's incoming scholar presenter is Keat, who comes to us from Singapore, where he's a PhD candidate in health systems and services research. His research focuses on physical function recovery after hip fracture among older adults and its associated prognostic factors. Keat would like to learn how to work with imperfect evidence to explore potential clinical or policy interventions to reduce disability resulting from hip fracture. Everybody, here's Keat.
Hi, very good afternoon, everyone. Thank you very much for being here. Thank you, James, for the opportunity to present, to share my reflection of my participation in the workshop, as well as at my attempt to apply the health system taxonomy that we learned in the workshop on aging-related policies in Singapore. So these are the 2 things that I'll talk about in the next 10 to 15 minutes. I'll start off with my reflection on my toolbox after attending 3 weeks of the workshop. So I use toolbox to describe the technical skills and the domain knowledge that I picked up and that I can apply in future work. So my research interest revolves around aging because I make it a personal mission to help myself as well as people around me to age well or better. I believe in prevention because I think prevention is better than cure, and prevention here means go for screening with some behavioral change. And I'm also interested in healthcare resources because I think ultimately everything we want to do boils down to whether we have the money or where we want and where we want the money to go. And also interested in healthcare utilization in terms of whether are we using too much of healthcare or using too little. So some of the past projects I've done things like around these topics, things like loneliness and healthcare utilization among older adults, antihypertensive medications and falls, because I was a pharmacist. And my PhD currently is on physical function recovery after hip fracture surgery. And in prevention, I've done project on healthcare, promoting amenities and cardiovascular risk factors, as well as cost effectiveness of BRCA mutation testing among breast cancer patients. Healthcare resources, I've done a project on cost function of hospital and primary care clinics in Malaysia, as well as efficiency of ophthalmology services. But then something was missing before I attended the workshop. I wish to advise healthcare policy. but there are so many policy problems, and which is beyond an individual's ability to research on all aspects of the policy, let alone researching multiple policy problems. And I think as a researcher, I can't only just be selling my own research to policymakers. My ideas may not always be the best that meets their needs. So what we learned in the past 3 weeks, I feel, is the missing piece that complements that put everything in my toolbox together. So in the first week, we learned how to search and use evidence to frame policy problems and options. In the second week, we learned how what makes an issue goes on government or decision agenda and gets implemented. In the past few days, we learned how to examine health system from multiple angles. So, as I mentioned, what we learned in the past 3 weeks pull all the existing tools in my toolbox together such that I feel more confident about my ability to advise policy options and implementation in the future. So aside from my toolbox, the past 3 weeks has been very eye-opening. It was my first time stepping into America, especially right here at Hamilton. I enjoyed all the discussions we had on each other's health systems, challenges and approaches to different solutions. And I also enjoyed our talks on different culture, languages and food. And one thing that I feel I learned a lot aside from health system is that Africa, or the history and culture of Africa, by talking to my colleagues here, than my past 30 years of my life combined. Yeah. So what's next for me in terms of my professional development after this workshop? In short term, I plan to use the skills that I learned to identify policy options, and I plan to model their cost effectiveness as part of my PhD thesis. In the medium term, I would like to master all the tools, or even pick up more that will strengthen my skills. And in the long term, I hope to be able to function as a health policy advisor or researcher and advise on health policy in Asia Pacific region. So I thought it would also be interesting to international audience here to show you some of the policies that are in place in Singapore on aging. This is by no means exhaustive. I picked several policies that I think may not be culturally acceptable in other countries, and also there are some, but regardless, nevertheless will be interesting enough to most of you, I hope. So before we go to the health system taxonomy, let's talk briefly about aging population. We hear this term a lot. There are many indicators, but usually we refer to the percentage of older adults above 65 years old. So we consider a country as an aging country or aging society when the proportion of older adults 65 years and above is between 7 to 14. Age society, if the percentage is 14 to 21. Hyper age society, 21 and above. So I try to put all the countries represented here on this graph, so you can, and plus Japan. Japan is the gold standard. 25 or quarter of their population is 65 years old and above. Spain, where Christina is from, Canada, Australia are considered age society. Singapore, Trinidad and Tobago are aging society, whereas Malaysia, South Africa and Nigeria are still considered relatively young. But Malaysia is getting old. Yeah. So as we are all aware, aging population increases demand for various health and social care needs. So healthcare, we know, we have talked about multimorbidity, disability, frailty, which leads to falls and fracture, social care, nursing, long-term care, isolation, loneliness. And at a country level, the government usually will worried about lesser working adults to contribute income to support the increasing needs of older adults. So before we move to Singapore policies, we need to know a bit of the context because there are a lot of policy legacies and the institutional constraints in place. So Singapore is a very small country. If you see the map on this side of the of the slide, the diameter is 50 kilometers, which means if you drive 100 kilometers per hour, you can reach from the east side to the west side in half an hour. Smaller than Hamilton, which has 750,000 population. Singapore has 5 million, out of which 4 million are residents. The term is used to describe citizens plus permanent residents. Among the residents, about 3/4 are Chinese, 13% Malay, 10% Indians, and the rest others. At birth, life expectancy for female is among the highest in Asia. 85 years old, for male is 81. But the total fertility rate is low, 1.2, which is below the replacement rate. And there are fewer and fewer younger people supporting the older adults over the years. And Singapore health system emphasizes self-reliance and self-accountability. So this means that government will provide you with a subsidy, but a portion of the healthcare has to come from your own pocket. So in the case of Singapore, as we are all aware, there's a medical savings account, MediSave, started in 1984, which the percentage of wages you contribute to it depends on your age. The money is not pooled, but you can use it to pay for the healthcare of your immediate family members, meaning your spouse, children, parents, or grandparents. Another local context we need to be aware of is that majority of Singaporeans live in public housing, about 80%. And these public housing are managed by Housing Development Board. They are sold at lower than market price, but priority is given to married couples as an incentive to increase the birth rate. Singles are only eligible by the time they reach 35 years old. And the ownership of this house is not permanent. It's 99 years lease, meaning after that you have to renew or you have to sell your house to the government to be redeveloped. So understanding this context, we go to the health system taxonomy. In the health system arrangements, there are three arrangements: governance arrangement, financing arrangement, delivery arrangement, and implementation strategies. So I'll bring you through examples. I'll bring you through the examples according to this order. So the first governance arrangement that I would like to share with you is the formation of regional health system in 2008. So what this reform does is that it integrates care across hospital, primary and community care level. So it's usually led by an acute hospital, which has a network with local primary care and community care sectors, and the whole system will be is financially administratively autonomous, and they are accountable for the population across these levels of care living in their jurisdiction. And originally there were 6 RHS, but last year it was regrouped into 3, and these are the 3 shown in the graph. And the second governance arrangement is to encourage community participation by encouraging voluntarism. So what the government did over the past few years was that they tried to create dementia-friendly communities. So what they did here is, what they have done here is they put funding to train citizens and local businesses to recognize signs of dementia and to help those with dementia so that they have the caregivers and the older adults with dementia themselves are less worried moving about in the community. So this is consistent with the aging in place policy. And each community has 4 to 5 go-to points, and these are the points where if you spot someone with dementia, you're supposed to bring them back to these points so that they can be picked back up by their caregivers. These points also serve as a caregiver resource center. Besides voluntary instrument, there is also economic instrument to encourage community participation. There is such a thing called proximity housing grant. So what this does is that you are incentivized to live with your parents or to live near your parents. So if you choose to live together with your parents, you get $30,000 Sing dollar. If you choose to live near your parents, defined as within 4 kilometers radius from your parents' house, you get 20,000 Sing dollar subsidy. This is to encourage you to live near to your parents. And if that is not enough, then there is a legal instrument. In 1995, the government enacted the Maintenance of Parents Act. So what this does is it gives parents a legal resource to a legal channel to claim monthly maintenance from their children. So to date, there has been 2,000 cases, out of which 70% has been order has been made, means that the children are asked to give the maintenance allowance to their parents under this act. Yeah. And so that's all for governance arrangement. For financial arrangement, in 2014, the government recognized they offer higher healthcare subsidy to the pioneer generation, defined as those born before 1945 or before 1949. And so this is the Prime Minister of Singapore promoting the pioneers generation subsidy. So what they want to do is this is to recognize the contribution of the pioneer generation at the early stage of the country. So they get MediSave top-up. So remember, this is one of the features of the Singapore healthcare system. Elderly or older adults who qualify will get annual MediSave top-up, subsidies for public health insurance, discounts of outpatient bills, and disability assistance. Older adults also qualify for caregiver training and also caregiver training grant. So every year they get an annual subsidy of 200 Singaporean dollar for their children, for the caregivers, the children or domestic helpers to attend courses to care for them. There's also home modification subsidy up to 95% to modify the floor to make it sleep resistant, to attach grab bars in bathroom, or to add a ramp at the house entrance. In terms of delivery, in preparation for the aging population, Singapore needs more nurses. So what the government did last year was that they implemented a training grant for mid-career individuals to switch career to become nurses or physiotherapists. So it's fully sponsored, and then but after which you have to serve a number of years with the Ministry of Health as a nurse in Singapore. There are also some voluntary delivery by the senior activity centres. Now remember that 80% of Singaporeans live in public housing. So because these public housing are under the government, so then the government can install or set up senior activity centre to take care of needy or vulnerable population in the public housing. So in these senior activity centres, they are befriending activities and provide communal spaces for recreational or social activities, and also to provide health and wellness services such as health talks, traditional Chinese medicine. In 2014, there was also patient navigators programs that are initiated. These are usually trained nurses and function within each regional health system. These navigators coordinate patients' movement between different facilities and institutions, ensure the continuity of care. In terms of implementation strategy, I remember in the class we talked about no example for organization targeted strategy. I think this may be one of them. So the government, to encourage older adults to contribute to the economy, they make it mandatory for employers to offer re-employment to those beyond the retirement age up to 67. Of course, the employees can decline, but they make it compulsory for the employers to offer. And then if the employers do employ someone up to 65 and above, then they get some credits, they get some money back, up to 8% of the person's wages, of the employee's wages, which is quite a lot. So in summary, I've shared with you 11 policies which categorize into these 3 health system arrangements and implementation strategy, and how these are tied to policy legacy as well as the institutional constraints in Singapore. And with that, I would like to wrap up my presentation. Thank you very much to McMaster Health Forum and Queen Elizabeth Scholarship, as well as my thesis mentor and my thesis committee. Thank you very much.
For those of you who are able to make it here today to watch the presentation in person, I want to thank you for coming out. For those of you that have watched the video later on YouTube, thank you very much for taking the time. Before we leave you today, I just want to take a minute to go over a couple of the links that are on the screen to provide you with additional information about our program and what our scholars have been doing. If you're interested in the Forum's Queen Elizabeth Scholarship Program, either the current program, which is ending in 2018, or the new program, which is actually being launched in mid to late 2018, I would encourage you to please click that first link. That will take you to the information page at the McMaster Health Forum's website and tell you all the information you need to know about our Queen Elizabeth Scholarship Program in terms of how to apply and how to be involved. If you're interested in other presentations and webinars by our Queen Elizabeth Scholars, I would encourage you to click on that second link. There you'll find all of the current webinars that have been done by all of our Queen Elizabeth Scholars, and future webinars that our scholars will be doing will also be posted there. And thirdly, you'll see that there is a link for our scholars blog page, which is machealthforumscholars.com. Our scholars write blogs about personal reflections about their experiences while abroad or when they visited Canada if they were an international scholar. So please visit that page and read some of the blogs that our scholars have posted. Feel free to follow us on Twitter at Mac Health Forum, and please follow the hashtag QE Scholars so you can see all of the fun and exciting things that scholars have been doing from multiple universities around Canada. Thank you for joining us, and we'll hope to see you again soon.